and not replace doctors. Getting used to working in the NHS is keep arguing against the consultant. Having interests outside of medicine, I think, is very important. PAs were employed because they were funded by the government, whether that's music, film, reading.
Hello, welcome to another episode of Doc Diaries podcast by Dr. Krishnendu Rajan Nair. I am so happy to welcome to today's episode a very special guest, the lead acute physician and rheumatologist in Maidstone Hospital, Dr. Alex Keoug. Welcome, Dr. Keoug.
Thank you very much. Thank you for inviting me as well.
Thank you. So I have a very interesting first question for you. In 2025, with AI support and growing e-consult platforms, what is still irreplaceable about being a physician?
Well, first make a statement, but I would like to have some more AI support. We have very little actually currently, but there's a lot of scope for it. AI can help us serve our patients better, but medicine is not just about making diagnoses. We also have to establish a relationship with the patient. Sometimes that therapeutic relationship takes more than a diagnosis and a prescription. That's where AI will struggle more. The role I see for AI is potentially inputting lots of information to help the clinician, and then communicating to the patient is a skill that is better done by people than computers currently, in my view.
Yeah. It's really refreshing to hear that perspective, because I know some physicians who are still skeptic about the encroachment of AI, as they put it. Yeah.
Well, I share that. There's so many things that can be done. Doctors, like people, actors, people in many jobs, are scared that they will have a diminishing role. And I think there's some truth in that. So I think people are right to be anxious, but actually there's lots of things that can be done better with AI as well.
Yes, I agree with that. Moving on to the next question. You have worked with many IMGs before. So what do you think is the mindset and the preparation that differentiates those who thrive from those who merely survive?
I suppose reacting to and learning from your environment. Clearly, people come from many varied cultural backgrounds, and getting used to working in the NHS is a big ask anyway. One of the groups of people who tend to do well are those people who work out early on that it's important they understand why the consultant wants a particular test, why they think it's a certain diagnosis. What sometimes happens and makes it harder for people to thrive is not wanting to disagree, saying yes, or not admitting they don't know something.
Yeah.
So there's people who will, for instance, ask, well, doctor, I don't understand why we need this MRI scan of the spine. Can you explain? That will allow the request that goes to radiology to be accurate. The question that needs to be answered will be one that's understood by the radiologist, who can then give the appropriate response. If the wrong question is asked for radiologist, then the scan itself might be reported correctly, but without answering the question that was actually intended. So what people want is not just a polite yes all the time. We actually want to know that people understood why we want this test done or we want that treatment given. And if you don't understand, then please ask. If you think the consultant is wrong, then by all means say, well, is there a possibility that there's something else going on here? And if that's raised, sometimes the trainee will be correct and the consultant will change their mind. What wouldn't be a good idea is to keep arguing against the consultant. That will be unhelpful.
Yeah.
But we are keen to hear everybody's opinion. We learn from each other. consultants learn from trainees all the time.
I'm very happy that you brought that point into light, because I think there are even cultural barriers when it comes to disagreeing with a consultant. Back home, there is a system of hierarchy that makes us not confident enough to question or disagree with a consultant.
That's why I make this point. I see that a lot, and it's overcoming that. It's not easy,
Yes.
but it's those people who can overcome some of those barriers
Yeah,
to thriving in this culture who will do best.
perfect. That brings us easily into the next question that I want to ask you. What do you think is the ideal NHS support system for IMGs should look like?
I think it should look very much like the support system for any NHS employee, with a little bit extra in terms of an induction for people who haven't worked in the NHS is by and large useful, and that's perhaps not necessary for people who trained in the UK NHS system. But once that and a period of extra time to bed in and get used to the different systems, different culture, then I think the support network should be similar to that available to our homegrown trainees. And that involves, I guess, a supervisor. It also involves a postgraduate department, an occupational health system.
Yes.
And then for religious support, there's often religious representative at the trust that can be very important to some people.
Yeah.
I suppose the other thing that's only really necessary at the start is accommodation. It can be very difficult if you're coming to a different country, especially with expensive rents and prices here. That can be something people need help with.
Perfect. Moving on to talk about burnout rates among juniors. It's growing now, especially with some complaints of overworking or difficulty getting into training and everything. And of course, a social transition like moving countries can be very hard, especially for the IMGs. How do you think a junior doctor should overcome burnout rates?
That's interesting question. I think not just for IMGs, but for any doctor or professional, focusing on one's work is necessary to get the most from it and to enjoy it, but everything in moderation. It's really important that people take care of their physical and mental health. In fact, by taking care of one's physical health with good diet and exercise, that can also significantly help mental health. Having interests outside of medicine, I think, is very important, whether that's music, film, reading, dancing, sports. Any of these things can help because it means that there's not just one focus, which is medicine, or medical specialities like surgery, that take up the whole sort of mind space, as it were. In terms of other things, support network, so peer groups are really important. What people don't necessarily realise at the time, but the first job they do as a doctor will tend to go really quickly, but they'll always remember it. And every job after that goes quicker and quicker and quicker. Okay. You make some really strong friends. You remember the people that you work with. So friends, other interests, physical health, and then a good relationship with your employer or seniors, such that if you are becoming overburdened, then that's raised as a concern before it becomes too late.
Correct. Yeah. Really good answer. Moving on to the next question. With the increasing competition ratios in internal medicine training, what do you think the applicants should do to set themselves apart in terms of portfolio as well as their interview preparation?
Okay. One has to accept that everybody will have passed their exams, so that in itself is not classed as an achievement, because you have to have passed your exams and your international language tests to even get an application. What then becomes helpful is other things. So those people who have taken an interest in organising charitable events, or have got prizes, or have presented papers, posters, that's a point of difference. It doesn't necessarily have to be medical. If somebody has let's say a keen dancing interest, that in itself will be a small point.
Yeah.
I always recommend that my trainees look beyond what the next year takes, but look at the application form for the next stage to see what scores points for your application form. For if you're Foundation 1, you already need to start knowing what you need to apply for IMT training.
Yes.
Because if you leave it till you're just doing the application form, it'll be too late. You need to have done this stuff already.
Yes.
So you need to look ahead, look at the application forms, how things are scored. And I guess the points are made about trying to avoid burnout and optimise quality of life may allow one to develop those interests which demonstrate a broad range of interests, capabilities that are attractive to an employer.
Yeah. I actually think that's an excellent point, because even in this year's IMT, when you try to get in your portfolio in the last minute, you can actually get nothing done. You cannot publish a paper overnight or within a month. It's like years of hard work. So I completely agree with your point, and I think it's a really good one. Yeah.
So that means you need to start looking at higher specialty training applications as well, so that you can develop over the next few years.
Point taken.
Really, it is.
Thank you.
Yeah.
Yes. Moving on to the next question. I want to ask you if you had any pivotal mentors in your journey, and what can your trainees do in order to find good mentors rather than just supervisors?
Well, absolutely. I was lucky enough to work in a hospital called Eastbourne on the south coast of England, when a rheumatologist and general physician impressed so many of his trainees that lots of us became rheumatologists.
Wow.
This person was not only a good rheumatologist, his practice of medicine was really, really good. He was an absolute gentleman. He was keen to teach. He's committed to work, and I found him sort of inspirational. And one of the main factors I went into rheumatology in the first place was Dr. Wojciechowski. So one of my rheumatology colleagues at this trust was also partly inspired by Dr. Wojciechowski. So he's had quite an impact.
Wow, that's really inspiring.
As to what it takes to find one, well, that's not entirely within your control, but I suppose in the same way as a supervisor who's going to work well with you will take an interest in what you think, what you want, what you intend to do, I think being aware of your supervisor's limitations and workload, so you can empathise with them.
Yeah.
And the other thing I would say is that you can learn from inspiring and really good practice. You can also learn and take a positive from things being done badly. So part of the learning that people go through is seeing things done differently and working out what you think would work best for you and for your patients.
Yeah. Talking about that, learning from things that you do badly, I find reflective practice very new in the NHS, because it was something that we didn't do back home. And I find that very useful. I like writing reflections in my portfolios. Do you have anything to add on to that point? What do you think about reflective practice, Dr. Keoug?
I think it suits some people better than others.
Okay.
Yesterday was doing some ARCPs, which is a end of year assessment for foundation doctors. Some people had none, some people had 24 reflections.
Okay.
And I think if somebody's very introspective, then it will come easier to them.
Yes.
For people who don't have that introspective, then it won't necessarily be something they enjoy, but perhaps should try and do a bit of, because it can be healthy. So, yeah, so for someone like you who enjoys it, do plenty. For someone who really doesn't like it, don't do none, just do a little bit, but you don't have to force it.
Got it.
And as I think we all know, no patient identifiable information should be in any of those reflections.
Yes. Perfect. Moving on to the next question. A slightly tricky question, I would say. With the growing number of physician associates, what is your thought on this trend? Is it helpful for the doctors? Do they complement the work of doctors, or do you think they complicate the work?
It very much depends. In the GP scenario, the PAs were employed because they were funded by the government, and whilst this was never supposed to happen, the GP practices would then not employ doctors because they would use the PAs instead, so that led to difficulties for GP surgeries. So I would say in that situation, the use of PAs was counterproductive.
Yes.
In hospitals, most of what I've seen is that they're potentially helpful as long as they are there to assist with patient care and not replace doctors.
Okay.
They have a much shorter training than doctors. It's sort of 2 years rather than at least 5 years. They're not prescribers generally, but they can be in a role for many, many years. They can get very good at stuff and learn to do stuff and provide a point of consistency such that doctors who are rotating in every 3 months or so can learn a lot and be taught a lot by the PAs. So you see two sort of conflicting answers there. It depends on the situation, how they're used.
Yeah. Perfect answer, yeah. Last but not least, I want to ask you what message you have to our viewers, IMG doctors, who are unsure if they'll make it in the NHS system. What message do you have to them?
Well, don't give up. It's not easy. I remember a trainee a few years ago looking in the eyes and said, "Oh, Dr. Keoug, there's so much to do. It's really difficult." And I said, "Well, it's meant to be difficult." So to the new IMGs, not everybody is guaranteed to make it, whether you're trained abroad or in the UK. It's not easy, so you need to commit to it. Take enjoyment from it. If you're doing a really good job, you'll take more satisfaction from it. So do the learning. Always think of your patient as a person. I see a lot of doctors who treat a diagnosis such as ischemic heart disease or ACS, whereas actually what the patient came in, it's chest pain and they've had no pain relief. So it's important to remember that these are people who've got diagnoses. Treat their complaint, not just the diagnosis. Do find out as much as you can before you start working or come to the UK. And it's nearly always helpful to have a clinical attachment which is unpaid but will allow you to observe, and that will significantly increase your chance of getting a job. The first job is the hardest one to get in the NHS. Once you've got one, it becomes a little bit easier. So persevere. It's not easy, but it can be worth it.
Excellent. Thank you so much, Dr. Keoug, once again for coming to our podcast and talking to our viewers. I'm very sure that many will find your insights incredibly useful. Thank you so much.
You're very welcome.
Thank you.
Thank you. Take care now.